Hi everyone, and welcome to another episode of ANOKHI Daily Spotlight TV. Today we're going to be joined by Dr. Noor Ladhani, who's going to be taking us through how to maintain a healthy and safe pregnancy. Noor, thanks so much for joining us today.
Thanks for having me.
Tell us a little bit about yourself.
Sure, I'm an obstetrician at Sunnybrook Health Sciences Center. An obstetrician is a doctor who sees women through their pregnancy and labor and delivery and right after the baby's born.
So Noor, pregnancy is 9 months, right?
Well, it's 40 weeks.
See, this is the thing. We think we know, but we don't know. Can you talk to us a little bit about some of the common misconceptions and the myths that exist around pregnancy?
Sure. Well, people should remember that pregnancy is a natural process and that they should live their lives pretty normally.
Okay.
One of the big misconceptions is that women shouldn't exercise in
I've
pregnancy.
heard that so many times as a personal trainer. They just think things should shut down and then pick right back up a year later.
Yeah, and that won't happen.
Right.
So it's recommended if you're healthy with a low-risk pregnancy that you lead an active lifestyle, and that means about 30 minutes of exercise a day at least.
Okay.
We say aerobic exercise is good.
And how about strength training?
Strength training is good as long as you're not holding your breath.
Okay.
So as long as you're allowing yourself to breathe.
Yes.
And when you're doing aerobics, as long as you're working out in a way that you won't lose your balance.
Right.
That you're avoiding any abdominal trauma, like through contact sports, and that you're not scuba diving. But otherwise, things are good. Swimming is recommended. If you were a runner before pregnancy, then running is recommended, although you might need to tone it down a little bit. Yoga is very good.
Good.
So exercises that will keep you active within the range of healthy.
Yes.
So you shouldn't be exercising to the point where you can't speak.
Okay.
There are heart rate guidelines depending on your age, your weight, and how fit you were before pregnancy. Nobody's heart rate should exceed 150, and it might be recommended to keep it even lower.
Lower than that. Okay, great. Great to know that we can maintain an active and healthy lifestyle all throughout pregnancy. Now, Noor, can you talk to us a little bit about weight gain? Because I know from the South Asian mothers out there, we're told that we need to gain like 50 pounds of weight. Can you talk to us a little bit about that?
Sure. Well, it's important for women to know that weight gain is an important part of pregnancy and to sort of accept that their body will be changing.
Right.
But remember that any weight that's put on in pregnancy has to be taken off after pregnancy.
Okay.
And so we want to stay healthy and not gain too much weight. In fact, there's more research coming out that increased and excessive weight gain in pregnancy might lead to harder labors and other complications, as well as long-term complications for the woman's health and potentially for the baby's health.
Okay.
And so it's better to keep that weight gain under control.
So Noor, we've all been told that you need to eat for two when you're pregnant, but can you talk to us a little bit about how you balance that concept of eating for yourself and eating for your children and not eating too much?
Sure. Well, as Health Canada puts it, you don't need to eat for two, you need to eat twice as well.
Oh, I like that.
So it's important to think about the nutrients and the vitamins you're getting in pregnancy, and that can be done through your diet, but some things are necessary to be supplemented with vitamin supplements. Otherwise, Health Canada says that you should follow the Canada Food Guide and just add about 2 extra servings.
That's that pyramid?
Exactly.
Okay.
Add 2 or 3 extra servings a day.
Okay.
So really pregnant women just need to take in about 300 extra calories a day.
Well, that's not much at all. Now that we know how much we should be eating, can you talk to us a little bit about the important vitamins and minerals that we should be consuming during pregnancy?
Sure, great question. Every woman who's contemplating pregnancy should be taking folic acid supplementation, at least 0.4 milligrams per day,
Okay.
and have iron in their diet and through their supplements. Iron should be at least 16 to 20 milligrams per day.
Okay.
But there are good dietary sources for these vitamins, in addition to the vitamin supplements that you're taking.
Right.
Green leafy vegetables are a great source of iron and folic acid.
Okay.
Oranges and orange juice are a good source of folic acid. Iron we also get from red meat
Yes.
and from other dietary
Yes.
sources. Another important vitamin and mineral in pregnancy are calcium and vitamin D, and we can get these from our dairy products. A glass of milk, some cottage cheese, those
Full
are
of
good
protein.
sources.
Good.
Exactly. In addition to these important vitamins and supplements, fish is a good part of every pregnant woman's diet.
I find that really surprising because I know a lot of people think that you can't have fish at all.
There are limitations to what fish you can have, but Health Canada recommends 1 portion of about 150 grams a week.
Okay.
They tell us to stay away from the higher order fish because of the mercury content. That's shark, escalar, tuna. Fish once a week is good. It contains important omega-3 fatty acids, which are helpful in the
Very
fetal
healthy.
brain development.
Thank you so much to Dr. Noor Ladhani for taking us through exactly what to do before the baby is due. For more of our show, catch us on ANOKHImedia.com and our YouTube channel, and be sure to interact with us on Facebook and Twitter. Catch you next time.